All of us in the dental profession deserve the high esteem that comes with working in dentistry. It's among the most respected of all professions, and it should be. Consider the fact that almost all patients leave our care cured and feeling better. Consider also that modern anesthesia came about through the efforts of Dr. Horace Wells, who discovered and first used nitrous oxide in patient care over 150 years ago, and Dr. William Morton, who administered the first anesthesia as ether in medicine for a leg amputation. Both of our heroes were dentists. Modern medicine's strict infection control regimen was perfected by dentists in response to the onset of AIDS in the general population in the 1980s. The most common chronic disease known to man, dental decay, will be eliminated within the foreseeable future due to fluoride, patient education, sealants, and even dental vaccinations. On a global scale, dentistry deserves the admiration it receives. Locally, though, you will be the element that sets the standard for dentistry. Your behavior both in and out of the office reflects the treatment given there. At times this may seem unfair, but it is the truth. It may seem strange to think, but a good patient-oriented dental practice can be compared to the beach. As a whole, everything looks peaceful and harmonious. Close up, though, we see the busyness of endless activities that make up the whole. The beach has seashells, crabs running about, birds probing the sand, wind, and even human visitors. In the dental office, we see hygiene activities, patients being scheduled, office workers processing statements, patients coming and going. And when everything and everyone in the practice is organized and working together, patients see the office as the professional place it is. Consequently, their trust is elevated and their fears actually decrease. This level of practice is not automatic, though. It takes the efforts of the doctor and the staff, and it's perfected over time. Some of your efforts may be obvious to the patients, like playing soft music and office cleanliness. Others are less noticeable, like speaking in soft tones, selecting kind words, and honoring the privacy of patients. Every dental practice needs a good system for welcoming patients, sequencing treatment, and even handling the mail. From the patient's first telephone call to their last day of active treatment, only a carefully planned and executed sequence will establish trust. This attention to detail helps to keep this trust throughout treatment and encourages referrals of new patients. And remember, new patients are the lifeblood of the dental practice. Professionalism goes well beyond direct patient contact. Organization is crucial to every aspect of dental patient care. For example, a reliable system to monitor dental supply inventory is so important. Some supplies, like anesthetics, are so critical that patient care stops without them, and the practice may even shut down if supplies are depleted. So an inventory system helps keep patient care flowing smoothly. Proper management of lab cases directly affects patient care too. A yet-to-be-received crown or bridge or a partial or a denture may result in the last-minute rescheduling of a patient, wasting hours of their time, other patients' time, and even the doctor's and the staff's precious time as well. Remember that the serenity of the beach is made up of smaller parts. Many seem not so peaceful, like broken seashells. Do we pick those up? Usually not. We pay more mind to the more perfect sand dollars and seashells. It's important to not dwell on minor setbacks that occur nearly every day, even in a patient-oriented dental practice. What's more important is to strive to do the right thing at each step, and in the end, the sum of all of your efforts will appear to your patients as a state-of-the-art, caring dental practice. As patients begin to form their first impressions of your practice, they are critically discerning appearances. Stained uniforms, messed up hair, flashy jewelry, these all adversely affect their impressions. Many of them are looking to you, the dental assistant, for clues about the professionalism of this practice. Think about this. If you're flying with a major airline and the pilot emerges from the cockpit wearing flip-flops and a tank top, you'd probably flee the flight. Well, a dental office is not much different. Patients take dental treatment very seriously. They can smell the medicinal nature of this place. They expect all of you to be highly skilled medical professionals. Again, this is very serious business to them, even more so to some than flying. It's known that flying and visiting the dentist rank high among public fears, and we need to do all we can to lessen those fears and help the patient develop confidence. This all begins with a professional appearance. Professional appearance includes many things. The first, your professional wardrobe, is fairly obvious. Dentistry moved to using uniforms, especially scrubs. The most important reason was the cleanliness factor, not just for patients' sake, but for yours and your family's as well. Remember that what you are draped with during direct patient care can become contaminated. It's imperative that the outermost coverings never be taken home by a staff member, but be laundered in-house or by a professional uniform service. In addition, these uniforms lend a more professional look to the office and help make you feel and look more professional as well. Still, it's this ability to prevent disease transmission that's so paramount, but it's only effective if they are properly handled. Another aspect of the uniform are the shoes. Aside from the desire to maintain a clinical look, which usually includes wearing white shoes, safety factors are much more important. So open-toed shoes and sandals are not allowed because they leave the feet susceptible to injury from falling objects. Dropped items could include contaminated sharp dental instruments. Ideally, these shoes should not be worn out of the office, but put on at the beginning of the workday and removed before leaving. Though not absolutely required, many surgical practices use paper shoe covers, much like operating rooms require. This could be considered practicing beyond the standard of care, which is never really a bad place to be. Other elements of personal protective equipment include the mask or face shield and gloves of various kinds. The gloves worn most of the day by the dental assistant are the disposable latex gloves. These protect both you and the patient from cross-contamination. As such, they should never be washed or reused. In fact, it's a good practice to remove them before even leaving the treatment room and putting new ones on when returning, assuming you're not carrying contaminated items out of the room with you. It's also a great idea to put the new gloves on in front of the patient, as it offers reassurance. In higher-level surgeries like implants or other oral surgery procedures, you might wear surgical gloves. Pay attention to properly placing these on your hands, maintaining their sterility. Inexpensive one-use vinyl gloves, much like those used in the food service industry, are also often used when handling dentures, impressions, lab cases. They are also helpful to people who are latex allergic, be them patients or staff members. And finally, rubber gloves are required when handling contaminated sharp instruments and when disinfecting treatment areas. These are the only gloves that we ever wash, using surgical soap each time a room is cleaned. Their useful life ends when they leak because of a defect. In these days of drug-resistant tuberculosis and other serious airborne diseases, masks offer the best protection. Whether you use cup masks or pleated masks is a personal preference. More important is to wear one whenever there is the risk of being exposed to aerosols from dental drills or a patient's sneeze. Occasionally, the face shield may substitute for the mask when it serves the employee, i.e. claustrophobic, or the patient, especially young children. Just as most of us wouldn't think of driving a car without wearing a seatbelt, or even going to bed at night with the battery removed from our smoke detector, we should never participate in patient care without eye protection when either flying debris or patient spray by sneezing or coughing is a risk to us. Aside from your personal protective equipment, there is no better protection for you, your patients, and your family than proper hand washing. The more patients see you do this, the better for them, and the more you actually do this, the better for everybody. We'll demonstrate the proper technique momentarily. It's also important to remember two more aspects of protection: your hair and your jewelry. pulling your hair back or wearing some form of hair cover not only keeps it out of the field of treatment for the patient's sake, but also minimizes its exposure to infectious spray that you might take home to your family. The same holds true for jewelry. Earrings and pendants, lapel pins, these can all become contaminated. Aside from sterilizing them before wearing them home, the only acceptable alternative is to remove them before patient care. Rings on the fingers are especially susceptible to carrying disease. Always remember that you are the expert in infection control. The more you know about it, the better you'll feel. Your patients assume you know it all, so do so. Being a professional involves having the proper attitude. Patients are allowed to not enjoy being there. You can't risk such thoughts, since our demeanor is projected onto our patients sometimes. So if we like being there, they'll tend to like being there too, as much as they can. Imagine yourself as a patient being treated by a doctor and a staff that acts gruffly, tossing instruments about, speaking tersely. That doesn't lend itself very well to a healing place. It's common pride in dentistry that almost everyone leaves our office healed. This is certainly true in a physical sense, but anything we do to bruise them emotionally is far from being healing. So keep disagreements with fellow employees out of patient sight and earshot. Even better, out of the office. Certainly keep your conversations about patients confined to professional circles. Best, concentrate on and cultivate only positive, healing speech about your patients, and you'll never have to worry about anything you said. Even telephone challenges must be managed carefully. Observing patients have no idea who is on the receiving end of your conversation. If it's spiteful and less than helpful, they'll usually assume innocence on the other end, and this makes you look real bad. And finally, remember that office visitors almost always appear when you least expect them. Patients are watching how you treat other people. Your good demeanor and attitude could benefit everybody. Certainly the attempt to treat every patient and visitor as family serves at the most noble level. So when drug or dental supply people, prospective patients, or laboratory technicians are on board, appreciate their presence as you would hope they would yours. As you work with your patients, keep in mind that the mouth is the most personal part of the body. It's been described as a barometer reflecting people's moods. A smile may leave as a frown, but hopefully only because of the local anesthetic. As such, all dental treatments should be considered surgical, delivered professionally in a sterile manner, and with minimal trauma to the patient's body and mind. Trust that all patients are apprehensive, as any normal patient should be. It's really only the patients that are absolutely ecstatic about having dental treatment that you should really consider abnormal. Patient trust and confidentiality. Aside from the fact that breaching these is about the only thing that you as a dental assistant may be sued for, their importance cannot be overemphasized. Every patient's medical history, even their financial status and dental treatments delivered, these are private matters between them and the office, and no one else. They even have to give their consent so you can share this information with insurance companies. Aside from that, there really is no other time when patient information should be shared with others. Not far behind the importance of confidentiality is that of your listening skills. Your doctor knows well the importance of patient autonomy, which is the degree that they participate in their care. It goes well beyond just their being there. They must understand and consent to the treatments. They must pay for the treatments. They must maintain them. Your job is to help them make a decision, hopefully the right decision, and then to honor it, whether it involves doing what you want or not. If the patient was properly educated and all possible treatments were outlined, accept the fact that they'll be doing the right thing for themselves.